Next-Gen NCLEX Case Study. Welcome back to the channel. In today's video, we're going to break down a full NCLEX style case study and walk through how to approach Next-Gen NCLEX questions. I'll guide you through a real-world scenario, explain the critical decisions, and help you understand how to answer each question effectively. Our case today focuses on sepsis, a condition that you'll likely encounter on the NCLEX. We'll go over the patient's symptoms, lab results, and what interventions are necessary. I'll then present a set of Next-Gen NCLEX questions that test your clinical judgment, critical thinking, and ability to prioritize care. Let's dive in. Case study, sepsis. Patient overview. A 65-year-old female with a history of diabetes and hypertension is admitted with a suspected urinary tract infection. She's developing symptoms like fever, chills, tachycardia, and hypotension. Lab results show an elevated WBC count and positive urine culture for Escherichia coli. Despite fluid administration, her blood pressure remains low, and signs of organ dysfunction are appearing. Next-Gen NCLEX question. Which of the following interventions should the nurse prioritize to address this patient's sepsis? A. Administer 4 antibiotics as ordered. B. Assess urine output hourly. C. Administer corticosteroids to reduce inflammation. D. Monitor for signs of organ failure. E. Initiate vasopressor therapy as ordered. F. Encourage the patient to drink fluids orally. Breakdown of the answers. Let's take a deeper look at each answer choice. We'll discuss why each one is important and how it aligns with the clinical guidelines for treating sepsis. By the end of this video, you'll not only understand the answer, but also why it's the best choice in terms of patient outcomes. B. Assess urine output hourly. Why it's important. Monitoring urine output is essential in sepsis management because it helps assess kidney function and signs of organ failure. The kidneys are particularly vulnerable during sepsis, and oliguria could indicate early signs of acute kidney injury. In context, although it's important to monitor the patient's urine output, it's a secondary priority compared to administering antibiotics, which are needed to treat the infection. C. Administer corticosteroids to reduce inflammation. Why it's not a priority. Corticosteroids are not typically recommended for the treatment of sepsis, except in specific cases such as in patients with adrenal insufficiency. In most cases, the focus is on antibiotics, fluids, and supportive care rather than corticosteroids. In context, corticosteroids might be considered in some critical situations, but they are not a first-line treatment for sepsis, and they won't address the infection directly. D. Monitor for signs of organ failure. Why it's important. Sepsis can cause multi-organ dysfunction, including renal failure, respiratory failure, and hepatic failure. Monitoring for signs of organ failure is a key part of managing sepsis. In context, while this is important, it's still secondary to the more urgent intervention of starting antibiotics and fluid resuscitation. You can't monitor for organ failure if the infection is not controlled first. E. Initiate vasopressor therapy as ordered. Why it's important. Vasopressors like norepinephrine may be required if the patient's blood pressure remains low after fluid resuscitation. This can help maintain perfusion to vital organs and prevent shock. In context, if the patient remains hypotensive despite fluid resuscitation, vasopressors will be required to prevent further complications. However, fluid resuscitation and antibiotics should come first. F. Encourage the patient to drink fluids orally. Why it's not a priority. In a patient with sepsis, oral fluids are often not enough to manage hypovolemia. IV fluids are required to rapidly improve the patient's blood pressure and tissue perfusion. In context, encouraging oral fluids would not be effective for a patient who is already in sepsis and has signs of hypotension. Fluids are much more effective for resuscitation. Conclusion. The correct priority intervention is A. Administer 4 antibiotics as ordered. This addresses the underlying infection causing sepsis, which is the root cause of the patient's symptoms and complications. Always remember, in sepsis, early treatment of the infection with antibiotics is crucial to improving patient outcomes. I hope you found this video helpful in breaking down how to approach Next-Gen NCLEX questions, especially with complex case studies like sepsis. If you have any questions or would like to discuss your answers, please don't hesitate to leave a comment below. I'd be more than happy to assist you further. And don't forget to like and subscribe for more content on NCLEX preparation. Your feedback is always appreciated.